Hi, my name is Atul Gupta. I'm an assistant professor in the Department of Healthcare Management at the Wharton School. Today we'll be talking about my paper on the corporatization of independent hospitals, which was recently published in the Journal of Political Economy, Microeconomics. The goal of our study was to quantify the causal effect of system ownership on prices for hospital stays for commercial insurers, operating costs per bed, and on the quality of care of independent hospitals. This study was surprisingly unique. I say surprisingly because system ownership has expanded in the hospital industry rapidly over the last 20 years. It's actually one of the most important phenomenons in the hospital industry. It's gone up from about 60% to 80% of all hospital beds. Even so, we didn't find a study which had looked at the causal effects of system ownership on hospitals. We find two main channels through which corporatization leads to a reduction in operating cost or efficiencies. The first and most important channel is a reduction in the number of people employed at the target hospital. Together, the reduction in staff accounts for about 60% of the total decrease in costs. Another 20% of the decrease in costs comes through a reduction in the cost of capital and the cost of financing. So together, these two channels alone can account for about 80% of the decrease in costs. One of the things we do in our study, which is also unique, is we examine not only the effects on independent hospitals when they get acquired by systems, we also examine the effects on hospitals that were previously owned by a system when they get acquired by another system. So these are two different types of deals. An interesting result is while we find pretty large reduction in operating costs per bed, as I just mentioned, when an independent hospital is acquired by a system, we find no effect on operating costs when a previously system-owned hospital gets acquired by another system. Now this raises the question of why. And the results imply that when a hospital is already system-owned and it gets acquired by another system, there is no centralization of services that they can do on the margin. We find no effect on their employed staff. And this suggests that the first time an independent hospital transitions to system ownership, the system does a pretty good job of optimizing human resources. And future transactions are not really able to improve on that. The primary findings of our study are two. First, we find that when an independent hospital becomes part of a system, its profitability improves remarkably. And secondly, we find no improvement in quality of care and some suggestive evidence of a decline in quality of care. We find that corporatization leads to an increase of prices per hospital stay of about 5% and a reduction in operating costs per bed also of about 5%. Now these two numbers might sound similar, but in dollar terms, the reduction in costs is about 4 times the increase in prices. We estimate that for the average hospital stay, the reimbursement increases by about $856. We also looked at readmission rates, which is a standard measure of quality of care, and what happens to readmission rates in both types of deals. Interestingly, we find that when an independent hospital is acquired by a system, readmission rates tend to increase. On the other hand, when a system-owned hospital is acquired by a system, we find no change or we cannot detect an effect on readmission rates. Now that we have these results, it should give antitrust regulators some food for thought. For example, one clear implication is that when a hospital is already system-owned and it gets acquired by another system, there are unlikely to be any efficiencies for consumers because we have shown that these deals do not result in a reduction in operating costs. On the other hand, when an independent hospital is acquired by a system, there is at least the potential for efficiencies that may be passed on to consumers. So antitrust regulators may want to think more carefully about the first type of deal where a system-owned hospital is bought by another system. I think there are two main takeaways from our study for policymakers. The first one is I think we should think about, rather than thinking about hospital mergers and acquisitions as a monolith, and thinking that all of them lead to similar results. But I think our results show that there are meaningful differences in the effects of these acquisitions also based on ownership. For example, in our case, the differences are quite large, whether the target hospital is independent or system-owned. So I think more needs to be done in the future, both by researchers and policymakers, to think about these differences. And the second takeaway from our study is that when independent hospitals transition to being part of a system, yes, we find an increase in prices, but there's a much larger effect on their operating costs. And so when you extrapolate this to the industry level, I think it's fair to say that the trend of corporatization of independent hospitals to being part of systems has probably led to a large reduction in operating costs for the hospital industry as a whole. Of course, the larger question for policymakers and consumers is whether consumers have benefited from this or not.